Hey there, if you've enjoyed this podcast, do me a favor and hit the like button, the subscribe button, the follow button. Just hit any button on the screen that you can find. Thanks for the support. Now let's dive into this week's episode.
Welcome to the Path Less Traveled podcast, where we dive into the untold stories of business leaders who forged their own path. Join Craig Heatherly, your guide on this journey of unlocking the keys to leadership success. This is the Path Less Traveled podcast. Let's go.
Let's go. Let's go.
Welcome to the Path Less Traveled podcast. This week we've got a special guest. We are featuring Paul Shetler, the Executive Director of Maple City Healthcare Center, to the show. Paul, welcome to the show.
Thanks. It's good to be here.
It is good to be here. It's the morning. Are you a morning person?
I am a morning person. My children get up at between 5 and 6 every day, rain or shine, so I'm the one up with them.
Last night, daylight savings time. Did that mess things up last night and this morning?
We broke it up over a few days. We were
really?
Yeah, we tried to I used to travel a lot for my prior job and with a lot of time changes. And so I got very disciplined at organizing how you make up those time changes. So have brought that over to the kids, so they've done fine.
That's next level parenting, right? Like, who even thinks about that? That's impressive. Wow. Well, I can't wait to get into a bunch of different things here because your background is absolutely unique. Your home structure is absolutely unique. What's happening here at Maple City Healthcare Center is absolutely unique. So the first question I've got for you is the title of the podcast. It's The Path Less Traveled. Mm-hmm. And as I did a little bit of research coming into this interview, my goodness, it's tailored specifically for you. So when you hear those words, The Path Less Traveled, and you think about your journey, what comes to mind?
It's a good question. So when I was in graduate school in Pittsburgh, I was on the board of a nonprofit called Family Services of Western Pennsylvania. And the CEO there was near the end of his career. His name was Don Gowler, and he was a mentor. And we were talking about sort of career paths, and his advice to me was don't think you're smart enough to plan your own career. Don't think you can anticipate what doors God is going to open, what doors are going to shut, where you're most needed in the world. And so his advice was excel at the job in front of you, do what you're called to do, and try to say yes when opportunities emerge. And so when I think of my career, you wouldn't plan this out of like, how would you get to be the executive director of Maple City Healthcare Center? You probably wouldn't think, oh, you should get a history degree from Goshen College. That's a useful, history and economics was what I studied at Goshen College. Then I went to Pittsburgh, studied nonprofit management and international development. From there, my wife and I were tag teaming, so she supported me when I went and got my master's degree, and then I supported her when she went to get her social work degree. And so I actually got a job at the Department of Veterans Affairs in healthcare. And there was a program where you could get fast-tracked into mid-level management. So pretty soon I was supervising, working in Butler, Pennsylvania, small hospital there. First started in specialty clinics, and by the time I left there, I was supervising all the diagnostic and specialty clinics, lab, radiology, dental, all those kind of places, plus all the check-in, check-out, administrative kind of services. And really loved healthcare, fell in love with sort of that community health lens. So went back for a master's of public health. And then my wife and I got this calling of, we should really go internationally. We should serve in places. We should use these skills in places where we can have even more impact. And so we uprooted our life there and went to Haiti. And we lived in Haiti for 5 years. We were country directors there of the program, doing just fascinating work. Loved our time in Haiti. Had both our children during that time. And then I actually transitioned into the global health coordinator for Mennonite Central Committee. So I was traveling to the 54 countries that MCC was working in, Had that role during COVID as their primary health person, managing those health risks and helping navigate 54 different sets of rules around the world and changing guidelines and helping staff navigate this, programs navigate that. It was really interesting and diverse, and I wasn't expecting to do that. And then this opportunity came up to use many of those same skills in community development, working in nonprofits, working in healthcare, health services administration, public health, to do that in my own community. And so I took that, jumped at that, said yes. So you wouldn't predict any of those shifts, but I think that sort of humility to answer the call and say yes.
It seems like, I mean, you've been put in plenty of positions for growth. When you think about the current stop and the previous stops, anyone stick out more as far as like the growth opportunity for you, and maybe it's just some things that you learned along the way?
Yeah, I mean, they've all had their own types of growth. So, I mean, there's probably nothing quite like your first supervisory job. So for anyone who's been a supervisor knows that shift, what that feels like. So when I went to the Department of Veterans Affairs, I'd been at the regional office managing programs, big budgets. It was interesting. We were doing innovative things. And then I took a position managing these 3 small clinics at the Butler VA. And all of a sudden, now as a young 20s something, I was now managing staff, some of whom were, 3 times my age, had specialty experience. So why am I their supervisor? Why am I the leader? What is my role here? How do I earn their trust? And so that jump of having to, I know what the books say about leadership. I know kind of what theoretically one's supposed to do in these kind of situations. But in practice, how do I earn the trust of an end of career dentist or a specialty physician, or a radiology tech who's been doing this work for 3 times as long as I've been alive? How do I develop relationships, and what is my value? And that jump is just enormous.
Yeah.
So they've all had stretch points. Managing COVID during that time with Mennonite Central Committee, that was an enormous time of growth, of trying to figure out and having to take responsibility for what were life and death decisions of what do you recommend to what staff, where, what guidance do you listen to when every country you work in is different and staff are relying on you? When do you make people travel in the midst of a time of fear and uncertainty because the work is important and it needs to get done? When do you not let people travel? When do you say that a feeding program for malnourished children is more important than these unknown health risks? When do you say it's less important and we're not going to do the work because we have to protect our staff? And having to wrestle with those kind of decisions in a time of uncertainty, in a time of really polarized politics, of staff and people around the world being just all over the map in how they thought about it, and trying to build trust and build confidence in the decisions that we were having to make. That was a huge growth area. So very different types of growth, but those were 2 that I'd point out.
So you've been the executive director here at Maple City Healthcare Center since October 24th, 2022. I know that because that's my birthday. In a full-time role. I believe you were in a part-time role for a little bit of time before that. Tell us about the organization. It's a not-for-profit. You serve probably a couple different communities. Tell us about what you do, where you do it, and maybe a little bit about the team.
Yeah, so Maple City Healthcare Center is a fantastic organization, just a rich resource we have in our community. It started in 1989 on the north side of Goshen, serving sort of that was the poorest community in Goshen, and really seeing its mission as serving those who are otherwise falling through the cracks of healthcare. So early in its life, Maple City was really focused on new immigrants to the community, for particularly those who didn't speak Spanish, And then the poorer folks in Goshen who didn't have access to good health care, didn't have strong health literacy, weren't feeling welcome in healthcare. Many of those were sort of older waves of immigration from inside the United States, including from Appalachia up to this area to work in the factories. Over time, the folks we have served has broadened tremendously. So we started as a neighborhood clinic in North Goshen. We now serve all of Elkhart County. We actually have patients who come from all the surrounding counties. We have folks who come from Michigan for our care because it's really outstanding care. I get my care here. My kids get their care here. Over 90% of our staff choose to get their care at Maple City, which is a huge testament to the quality of that care. We were awarded this year HRSA, the Health Resources and Services Administration. It's the federal regulator who oversees us. So we are in their highest tier of quality clinics anywhere in the country. So we're in the top 10% of quality nationally. That puts us in the top 5 clinics in Indiana, and we've had that for 5 years in a row since they started that quality metric. We do outstanding care, and it's really holistic care in a way that very few other organizations do. So the core of it is primary care, preventive care, family medicine, a place where the whole family can come for their medical needs. It's outpatient care, so we don't have a hospital or any kind of inpatient sort of services. But we do primary care, we do pediatrics, we do OB care, we deliver babies, so we deliver our own babies. We do the full prenatal care and delivery with Goshen Hospital in partnership with them. We have mental health, we have addiction services, we have dental services, we have tattoo removal offered here, we have medications on site, labs, vaccines. It's a pretty holistic set of services that you'd be pressed to find that range of services, that integrated and at this quality anywhere around. And then we do it in a way that's affordable, accessible to anyone. So we have the highest rate of uninsured patients in the state, but we believe that they deserve care just as much as anyone else. We have a lot of people who are very minimally insured, have huge deductibles, struggle to pay those health bills. We want to make it affordable for them to come here. We have the highest percent in the state of folks who speak a language other than English. So Spanish is our most common language after English, then Haitian Creole, and Ukrainian Russian, Portuguese, Arabic. We've got dozens of languages here. And we try to make it a place that those people feel just as welcome as folks who are coming in native English speakers. So 92% of our staff are bilingual. That's really unique. So particularly if you're a Spanish speaker, everything from the call center to your check-in staff, your medical assistants, your nurse, your provider, your mental health provider, you can get all that care from native Spanish speakers, which is just remarkable. So we really want to provide that highest quality of care, but we're going to do it to everyone. So again, that idea of being the place where everyone is cared for, where no one's falling through the cracks, and getting preventive health, not having to wait because they don't have options, can't afford their meds, end up in the emergency room, end up in urgent care with huge bills that then saddle a family, sometimes for decades, push people into bankruptcy. We don't want to get to that point. We want to do it as a preventive measure. So that's what Maple City is. It's really an honor to be here and help lead our team. We've got a fantastic team. We have about 156 staff right now. We serve about 10,000 patients, most of whom are from Elkhart County. We have a concentration here in Goshen, but they're coming from all over the county. And our newest site where we are today at Peddler's Village, it's called the West End Community Health Center. It's actually our fastest growing clinic, one of our busiest now. And it's kind of located between Goshen and Elkhart. It's really a convenient place for a lot of people in our county to come.
Yeah, I had the pleasure of going on a quick tour right before we did this podcast interview, and beautiful, beautiful facility. Tons of smiles as you walk through the building. You mentioned the growth there of the new building here within the organization. Tell us a little bit about maybe what's on the horizon, what is next, because based upon our conversations and kind of what we've experienced over the last couple of years, we're not standing still. We're continuing to evolve and meet the needs of the community. So what is next?
It's a great question. So the needs of our community are vast, and we're not meeting them yet. We're trying. We're serving a lot of people who need us, But there's a lot of people who are not yet patients, who don't have a medical home, who don't have a place that they trust that they can go to. And so we want to try to better meet those needs. That happens in a lot of different ways. So just in the last year, one example is we added autism services to be able to do autism evaluations. We have great providers like ADEC and Logan, around here, folks that do services, but they need to have a diagnosis first. They need to know that what exactly is needed for this person. And many of our patients were waiting up to 2 years to get treatment. And when you've got a kid, you're trying to do early intervention. That doesn't make any sense to wait 2 years. So we added that service in-house. We have a pediatrician who does that. We then added a psychiatric NP who's doing those evaluations, and we're just adding another one here in the next year so that we can fully meet that need for our patients. Another service we're adding, this is in cooperation with CAPS, is adding SANE, which is sexual assault nurse examiners for kids. So if a child experiences sexual assault in our community, we have some great resources like CAPS where they can do interviews for that kid's, forensic interviews, figure out what happened, make sure they can work towards holding the perpetrator accountable. But for the child, to actually get the medical exam that's required, right now they have to go to St. Joseph County or to Fort Wayne. This is often, this is the worst day, worst week of this family's life. And it's not just the kid who's impacted. Think of the mental health needs of the family, of the parents, the siblings when they find this out, the physical health needs of that kid. And so sending them to a place where they can do a checkbox evaluation just for the legal purposes, we don't think that's sufficient. We think, A, they should have it in their own community here, but B, those kids should be able to get wraparound services. Do they need mental health treatment? Do they need prophylactic meds? In cases where a pregnancy might develop out of that, are they getting services? We want to make sure that we're really wrapping around that family. So we recently were awarded a small grant from the Community Foundation, and then are going to be working in the next 6 months to build that program out so that kids in Elkhart County can get that service here. So that'd be one example. Another example is just growing out to serve more patients with the full range of services that we do. So we're continuing to bring on a few more providers. We're filling up in space. On our busy days, it's pretty crowded, but we're really trying to maximize every dollar we have, every square foot we have to provide care to the community. And so every time we bring on a new provider, that means we can add new patients, which means we can add new referral pathways. We can open up to the schools to send kids here. We can open up to other nonprofits and folks in the community who need care.
Well, let's shift a little bit here towards a little bit more specific to your leadership journey. As you lead, and I know you've got plenty of experiences that help shape and mold, the type of leader you are today. But talk to us a little bit about what kind of a leader you are today. Like, how would you describe your leadership style and maybe how you'd like it to be perceived? Like, what's the intent around how you lead?
Great question, and one that's a little hard to answer without cliches, right? Because, there's a lot written on leadership. I think for me, the way I try to lead is really focused around a few kind of core values or principles. And those would be humility, trust, and alignment. And so humility, as I was saying, this idea around leaders having the self-awareness to know what their strengths are, what their weaknesses are, and the importance of listening to other people. When I started out as a supervisor, I started out, again, supervising people, many of whom who were much older than I were. They had specific clinical expertise that I did not have. I couldn't pretend to do their jobs better than they did their jobs. And it really started me out kind of having to take a stance of humility towards the staff that I managed and listen to them and what do they bring to the table. One of my early mentors in the VA, he told the story about how when he started out in management, he noticed that the same jokes that he had told as a frontline staff, suddenly when you become a supervisor, people laugh at those jokes. And when you become the leader of the organization, people think you are just so smart and funny. And the reality is you haven't gotten any funnier and you haven't gotten any smarter. But people want to affirm you. They want to agree with you when you're in when you have power, when you're in a leadership position. And so it takes humility to recognize that you're still the same person. I mean, hopefully we're getting wiser. Hopefully we're learning more. We're gaining experience. But to have the humility to try to separate those things and to take your own ideas, to think about them critically, to take people's insights, to take their feedback, and to create a culture. The second one was trust. To create a culture where people can push back, where people can give you their honest opinion about your ideas, about yourself. So really trying to create a culture where people can be honest with me. Healthcare tends to be a very hierarchical culture. There are the folks at the top, and they know what's right, and they've got the education, and they're in charge. And then it goes down from there, and there's a pecking order, often in healthcare. And that can be really destructive because often it's the medical assistant or it's the nurse or it's the check-in person who notices that something's off with the patient, that maybe their needs are not what they're saying they are, and we need to ask a different kind of a question. And the same thing's true in leadership. I might have some great ideas, but so might our check-in staff or our billers who are noticing something. So trying to create a high trust culture where people are able to sort of bring their full selves and be honest and open with each other. And so this humility, this trust, and then having a culture where we're aligned around a shared vision. So less about, this kind of micromanagement of making sure everyone is doing exactly what I want them to do, but alignment around why they're doing what they're doing. And, I think what often goes wrong in big organizations is the way you manage scale, is you start micromanaging detail, and the policies become so prescriptive and the roles become so narrow, and your job is this, and you stay in your lane in your silo. But the problem is, in healthcare, we're dealing with people. People are complicated. And their needs may not fall into our silos. And they may be calling in, and the person they might be comfortable talking to is the nurse. But what they really want to talk about is their mental health care needs. And if that nurse doesn't feel equipped to listen and hear them out and get them to the right person, if they just say, that's not my job, I'm sorry, you need to call this number, we may never hear from that patient again. So having alignment on why are we doing this? Why is this important? That is really this complement to the trust, to the humility, where if we can manage in that way, if we can lead in that way from top to bottom in the organization, then we're going to be able to show up for the patient. We're going to be able to be humble with the patient. Maybe we think the right answer is this particular course. But if we can have an open and trusting relationship with that patient, maybe they tell us that because of their family situation, that's never going to work. And then we can actually give them advice. We can give them perspective on a different option that they actually might do. So it ideally flows through not just from how I'm treating the direct people that I work with every day, but that those same principles would translate through to how we care for our staff. So that's how I would hope. That's what I am. That's what I'm trying for. But hopefully, having the humility to recognize that clearly I would fall short.
Yeah, it's a goal for all leaders, right? To achieve a high trust culture, high trust organization, where individuals truly believe that you've got their best interests in mind. And you just said right there that people are complicated. So what's one of the most challenging parts of leading, and also what advice would you give to a younger you or just a young leader trying to navigate leadership?
Yeah. people are complicated, and if people weren't complicated, you really wouldn't need managers. You wouldn't really need most supervisors. I think the biggest advice I would give to young leaders, particularly if they're sort of advanced in leadership for their age, if they're coming in, they're young for the type of position they're in, is that humility. It's that constant listening and learning and being self-reflective about what are your strengths, what's your value add, and where do you need to listen and where do you need to grow? Because it's often easy to jump to conclusions about people. Well, the staff isn't performing because they're lazy or because they just don't care. Very frequently, that's not the issue. It's a lot more complicated than that. People are complicated. Maybe stuff's happening at home. Maybe they're frustrated. Maybe they had a different idea for their career, and no one's ever asked them about it. And so in this kind of an organization where we're managing a lot of change, we have patients coming in with complicated needs. We have to balance a lot of things. There's a lot of trade-offs. How much time do we spend with the patient? In a perfect world, we'd be able to spend all the time in the world, but there's other patients waiting. So every minute we spend with this patient beyond what they're scheduled for means the next patient is waiting an extra minute. Maybe they're going to be late for their job. If we take an extra 20 minutes with this patient, maybe the next patient's going to be late coming back to their factory job, and they're going to get points, right? So there's trade-offs here. There's no perfect solution. And so trying to stay humble, try to stay focused on why we're here, what we're doing, and remain open to people giving you that feedback along the way so we don't get too stuck in any one particular way of working.
Goshen College alum, right? I saw online you and your wife received a Young Alumni Servant Leadership Award. And the quote on the article was, "They have given up their time in their lives to focus their energies and gifts on responding to the voices of the marginalized." And a moment ago, you were just talking about your employees not just buying into the what, but aligning around the why. What's your why?
Yeah, so to go all the way back, I was born in East Africa, in Tanzania. My parents, so I come from a long tradition of service. My grandparents did service in Haiti in the 50s. My parents were working for Mennonite Central Committee in East Africa. My brother was born in Ethiopia. I was born in Tanzania. I grew up in Tanzania, particularly at a time, this was when HIV/AIDS was new. And it was just ripping through East Africa. There was no effective treatment available, and huge stigma and shame. I went to way, way too many funerals of family friends, of parents of my friends, of folks in the community who were dying young, who were dying often alone. There was stigma around it. Healthcare organizations were not there for them. And it was really the community and the church, family members were sometimes all there was. And it started in me a sense of a calling for trying to make sure that everyone is entitled to dignity. Everyone is just as worthy as anyone else. We're all children of God. We're all created in God's image. And so when you see someone dying on the street who is, they don't have housing, they don't have health care, they've been marginalized from their family for these kind of reasons, stigma, whatever. That person has no less value, is no less entitled to dignity than I am. And so if we really take that seriously and that faith calling to care for others, Maple City's vision statement is a community where everyone is cared for. Because it's not just internationally that's happening. In our own community, There are people who are suffering in silence. There are people who are suffering in their homes. There are people who haven't even told their family about the issues that they're dealing with. There's people who are facing bankruptcy because of medical issues that if they had taken care of them earlier, they wouldn't be in that situation, or dying many years younger than they would have needed to, leaving behind people who are grieving. And so if my why is, can we be useful in that? Can we help tip those scales toward care and dignity and treating people the way we would want to be treated? I mean, in some ways it's pretty simple. It's sort of the most fundamental Christian calling, that we would treat people the way that we would want to be treated. We would treat them as children of God, as people equally deserving of care and worth as we are. And so within the health sphere, what does that look like? And so that's why I try to do what I do, and it's why my wife and I went to Haiti. We had great jobs in Pennsylvania. We could have stayed there and built very comfortable lives for ourselves, but we felt like we needed to do more. And so when the calling came, we tried to say yes.
I've got two final questions for you. So titles you've held: Executive Director, Country Director, Director of Global Health Programs. You've been a professor at Goshen College. Is that accurate? Been on boards. You've got two kiddos. You've got a wife who is also the leader of a not-for-profit in the community. There's been a lot of achievement. There's been a lot of things that you guys have done. What are you most proud of as you look back on your life?
Yeah. So when you ask the question of why, this question of how you care for, in some ways, the least of these, I'd say there's two parts to that. One is, I think the role I am most proud of is being a father, of caring for my kids. That's, in some ways, there's nothing more sacred than having that responsibility for new life. And then on the professional side, a project that always sticks in my mind. We had a project in Burkina Faso that I helped co-create with folks on the ground. I visited and helped lead this project where they were working they had horrible infant mortality rates in their community. And they started a project where the community really rallied around these families. And this idea that these are everyone's kids, that these kids, yes, the parents have a really important role there, but the whole community wants these kids to thrive and live. And so how do we support one another? And that it's not just about the health system or about, a benefits program. It's about, as a community, we care. And they started these care groups where families would get together and support one another through some of these most difficult times, learn from one another, help each other out. It's a very low-cost program, but that program alone was saving about 26 kids a year. And it was one of many programs that I supervised at that time. Lives are saved every day here at Maple City. Done good work in many different settings. But when you can see that concretely, that every year that project was running, 26 more kids are alive today than otherwise would be. And having been able to been part of creating that, and it's not that you're the only one who did it. There were the local folks on the ground running it. Just like here at Maple City, we're caring for 10,000 people a year. That's a huge responsibility. It's also a huge honor. I'm not the one touching those patients. I'm not the one giving the vaccines or taking the blood or giving them the medicine or doing therapy with them. But to be able to be part of it, that's something I'm really proud of.
Last question before we wrap up with some final thoughts here. You've obviously been around a lot of people that have had an impact in your life, and some, I'm sure, in the professional sector, but then also in the personal side of things. When you think about who has had some large impacts on your life, and I guess who comes to mind, and what are those impacts?
Mm-hmm. I've been blessed with a lot of fantastic mentors and guides along the way. I've mentioned a couple of them. I think, though, if you had to have the biggest impact, it would be my wife, Rebecca. She has been my best friend, a phenomenal companion through this. She was crazy enough to say yes to going to Haiti and doing all kinds of things. She's also been watching her, walking alongside her through her leadership journey while I was doing a similar kind of a thing. So she started as the CEO of CAPS a month before I started here at Maple City. It's also reinforced some of those themes for me around humility, because we are incredibly different people. When we both face a similar challenge, we handle it in dramatically different ways. We present in very different ways. And from, as someone who's been relatively successful in leadership, I can be very confident, like, my way is the best way. I know how to do this. And so when I see a leader doing a completely different path, choosing a completely different way of presenting something, it'd be very easy to be like, well, that's not going to work. Like, but it works. She's fantastic. She's a better leader than I am. She's amazing. And she's doing it completely differently. And so it helps remind me every day. I think our spouses can often do this for us. Remind me every day that there's another way of doing things that can be just as, if not more effective. And so to keep that humility personally and professionally about, this is how I would do it and why I would do it this way. It may not be the only way. And so trying to keep that stance of listening and humility.
My goodness, what a unique dynamic there. Holy cow. I mean, you just talk about sounding boards and iron sharpens iron, and my goodness, you've got it at home.
Indeed. It makes scheduling childcare a little complicated, but we muddle through.
Oh, well, as we wrap up here, what final thoughts do you have that you'd want to share, leadership specific, about Maple City Healthcare Center? Any final thoughts that you'd want to communicate? The floor is yours.
Thanks. It's been a great conversation. I think it's an exciting time for Maple City. We are growing like crazy. We've grown 50% in a year, so we're seeing 50% more patients today than we were a year ago. That's been a huge change. It's been a change for the better, but it's a lot of work, a lot of stress. But when you're doing hard things for the right reasons, it makes it really worth it. It makes it invigorating. It makes it worth getting up in the day and worth the sacrifices that it takes to do this kind of work. So I think I would encourage folks who are listening, particularly if they're early in their career, to around this idea of saying yes and finding that why, finding the greater purpose. Why are you doing this? What is worth that sacrifice for you? And then answering the call, because the opportunities are always calling. The needs are out there in our community. There's a lot of work to do. And if folks are willing to say yes, willing to stand up, and able to reflect on what motivates them, what drives them, I think we can create a better world, a better community, if more folks find that and dig in where they're able, where they're called to, which is going to be a different place for everyone.
Well, thank you for saying yes to this interview. I've enjoyed it.
It's been a pleasure. Thank you.
Well, that's it for this week's episode of the Path Less Traveled podcast. Have a great day.
That's it for this week's episode of the Path Less Traveled podcast. Be sure to follow us on your favorite podcast platform. From Craig Heatherly and all of us, thank you for listening.